gonna check the patient's name, Philip Brown, 61 years old, PIN number 444 444 555 666 666, and I'm gonna be comparing the MAR and the doctor's orders. It's gonna be hydrochlorothiazide, 50 milligrams PO twice a day BID. Furosemide, 40 milligrams PO daily. Fluticasone, MDI, every 6 hours, and morphine for 10 milligrams every 4 hours PRN. I'm gonna check the MAR. It's hydrochlorothiazide, 50 milligrams PO BID at 8 o'clock. Same. Furosemide, 40 milligrams PO daily at 8 o'clock. We're not gonna administer the fluticasone at 6 o'clock. It's MDI at every 6 hours. And no, the patient's not in pain. So the morphine, 10 milligrams every 4 hours PRN, PO. Right medication is all correct. I'm gonna look at the label. Everything is correct. 50 milligrams and 40 milligrams. Now I'm gonna go inside. I'm gonna check for the expiration date. Yeah. And the patient has allergies for acetaminophen. All the medication is not acetaminophen, so it should be fine. And hand hygiene performed. We're gonna be administering hydrochlorothiazide because the patient it's for hypertension and it's an antidiuretic. We're gonna administer furosemide because it's also an antidiuretic. And gonna calculate doses correctly. How much total?
Just right.
So, is there anything you need right now, Mr. Brown? So, I will come back later and check your blood pressure levels.
It's 40 milligrams.
And then I will put your side grill up and put the bed down.
There it goes. 50 milligrams.
Your head's up.
Hmm?
Okay, sounds good.
Okay.
Submitted.
In your or
Alright. Now, I prepared the medications, poured the pills, ensured everything is fine. I tidied everything up. And now I'm gonna go inside. What am I supposed to do? I'm gonna change the name. Patient's name is Philip Brown, 61 years old. I think I have to retake it.
Keep going,
Oh.
because this is a self-reflection. So just keep going. Take that with you.
What I'm supposed to do again? Second check.
Yes.
So,
The second check would be with the meds.
okay.
Make sure your meds are correct with the MAR.
Yeah, so hydrochlorothiazide, hydrochlorothiazide, thiazide.
Make sure that's what's in here. Don't look at this anymore.
So it's hydrochlorothiazide, 50 milligrams. Furosemide, 40 milligrams.
Is it the right time?
8 o'clock.
Right person?
This is Philip Brown,
Right route?
and both PO. And frequency twice a day, and furosemide is daily. I'll put the containers away.
Mhm.
Do not leave meds untended. Take supplies for eye drop. Safety check. So I go inside. I look for the brakes, anything that's hanging, the cauldron here, and anything kind of hazard. And I introduce myself. Hello, Mr. Philip Brown. My name is Alexander. I'm your nurse for today. We're gonna administer your drugs for 8 o'clock. So, name and designation. I'm gonna check for the armband, if it's correct. Check with the allergy, acetaminophen, Philip Brown. Okay. You are Mr. Philip Brown, right? Okay. When were you born, Mr. Philip Brown? It tells me the birth date. 61 years old. Check. Do you know what your allergies are? Acetaminophen. Correct. Now I'm gonna go for the third check. State out loud. Label meds. This is Mr. Philip Brown. Furosemide, 40 milligrams. PO at 8 o'clock daily. And this is hydrochlorothiazide, 50 milligrams. PO 8 o'clock twice a day. And for Mr. Philip Brown. Identify each med. Furosemide is an antidiuretic. I forgot. I remember that. Hydrochlorothiazide is for hypertension and is also antidiuretic. If the blood pressure is low, I cannot administer it. I have to withhold. I'm gonna check for the O2, how he's breathing. I'm gonna check for BP before I give this to them. If the BP is too low, I can't administer the hydrochlorothiazide. And I'm gonna check for the pulse and anything else. Like if he's in pain, if I have to administer the morphine. Anything else? Right. So I'm gonna do put the patient in a suit.
Okay, just wait a second. I didn't press it yet.
Now I'm gonna give the furosemide. Hello, Mr. Philip. I'm gonna give you your medication now. Would you like your medication? Okay. I'm gonna give this to them. If they are able to take it themselves, they took it. I'm gonna ask them if they swallowed it properly. Can I see your mouth? Can you stick up your tongue? Okay, thank you. Now I'm gonna administer hydrochlorothiazide, 50 milligrams PO, 8 o'clock, twice a day. Mix yourself around, give them this. They can swallow it themselves. Ask them to open their mouth, stick up their tongue to check it. Can you stick out your tongue, Mr. Brown? Okay, everything's clear. Take this away. I document 8 o'clock today, initials for both furosemide and thing. Okay, now I'm gonna put you back in a comfortable position. If there's any pain, any issues, you call us, or you call the call bells right here. I'm gonna check again if the brakes are on, anything, any clatter, is the medication still here? If they're fine, and I'm gonna check again for pulse, BP, and O2 a few minutes after the medication's been administered, and I'm gonna tell them that I have to go. If you need anything, call me. Call us or pull the bell, and that's it.